All right, and welcome back to another AltMed episode. This time I'm introducing, just to keep things a little bit different. Please remember to like and subscribe, as we need to say the obligatory piece each time we do this. This week, I'm very excited to introduce Mike Cleary from Sativite. He's got a very interesting background, some very good insights, and some great experience from different areas. I won't go too much into it. I'm going to let him do the honors. But Mike Cleary, please welcome to AltMed, and please tell us a little bit more about yourself and where you come from.
Welcome, Mike.
Yeah, great. Thank you. Great to see you guys again. It's fantastic to be part of the AltMed recording for this one. So thank you for the invite.
Pleasure.
Our pleasure.
I suppose a bit about me. I'm medicinal cannabis patient as well as CEO of Sativite, medicinal cannabis, pretty much medicine providers to Australia, New Zealand, and all over the world shortly. So it's it's a great honour to be selected for a job like this, to actually bring medicinal cannabis, I suppose, to the forefront for patients as a alternative style medicine. But it's really turning into it's really getting a massive following with patients as they see the success of it, as you guys have done from podcasts before that I've seen. So I think the best thing we can do is get the message out there that there is alternatives out in the marketplace.
Yeah, well, it's kind of
I agree. I think I was
sorry. I'll let host.
I'll let you go.
I was going to say, I mean, we call it alternative medicine, and it's really slowly creeping into mainstream medicine. I know the TGA obviously still has a different view about it as an unapproved therapeutic good, which we of course respect. But it's, as more and more people get prescribed medicinal cannabis and have a go, it's, from the doctors that I speak to, it is actually replacing their conventional medicines in some cases, which really is astonishing. It's rise from kind of a complementary thing that you might have in the medicine cupboard to people's main therapy.
Yes, that's exactly what we're seeing, the transition across. I spend a lot of time in front of doctors, patients. I'm a massive advocate for it because of what it done for me as a patient as well. A lot of people know that I was on a lot of opioids. To transition from that from that style of drug, which did have its place, it did work well. But with the medicinal cannabis and what it's actually allowed me to do as a patient is just mind-boggling. And I know it doesn't work for everyone, but my theory is it's definitely worth a try, because my next step, talking with pain specialists that were looking after me, was essentially that if I keep going the way I was going to be on even stronger painkillers, much like methadone, which is a final step. So to now actually being totally off opioids, it's a massive difference. And a lot of the doctors still can't believe, and it's mainly because of my injuries. So I had a lot of nerve damage from multiple spinal fractures, root and nerve ending damage through the pelvis. So for me, medicinal cannabis just really works as that anti-inflammatory, because that's where a lot of my pain was coming from, was from the nerves. So massive change.
Very interesting. It sounds not exactly the same, but it sounds a little bit like I'm sure a lot of people have heard of the Charlotte's Web kind of thing, where the story and the brand is kind of born somewhat out of somebody's personal experience with suffering and the relief they found in cannabis, which is an all too familiar story now, I'd say. Going to what you said before, I think, we're starting to see that blend of the two worlds. So traditionally, cannabis is kind of sat in this almost like hippie-like area, and like not Chinese medicine, but non-traditional, non-Western medicine kind of field. And now we're starting to see, products get added to the ARTG, and really the clinical data coming out showing there is efficaciousness or efficacy rather. And it's kind of now being adopted in mainstream medicine, but it's still doesn't deter people who feel that it's, got these kind of more spiritual properties, if you will. So we're seeing this kind of two worlds collide, which is a really exciting thing. And I can't think of any other drugs that maybe do that at this point.
Yeah, I agree.
And with hardly any side effects. That's what I love about it. Nearly every drug that I was on, which there was multiple, they all had a side effect that it's up to the patient to decide what side effect fits in with their lifestyle and their pain management. And it's really good to see a lot of the larger players now doing a lot of the, I suppose, the photokinetic studies or pharmacokinetic studies on products to be registered, like the Schedule 3 of CBD, which is coming just around the corner. So I think it can only mean good things for the cannabis industry. It is a long road. I would imagine we've probably still got another 5 years of researches and studying to do. And the deeper we look, the more we start to see like the entourage effect from terpenes. And even the types of carrier oils that are used and everything. So that's, it's very exciting.
Well, and that's definitely... go on, Andrew. You get in there.
I knew that as soon as you mentioned entourage effect, I was going to get excited. But I will actually park that, because before we dive into that, only if you're comfortable sharing, Mike, but I'm really just interested to hear a little bit more about your journey as a patient before we sort of talk a bit about Sativite and everything, because I know that, of people that have started to tune in to our podcast and, and on the many Facebook forums about medicinal cannabis, it's so interesting to hear everyone's different experiences with it. But are you able to maybe just talk through what happened to you, what your condition was, what you were treated with, some of the specific side effects you were dealing with, and then how cannabis helped you?
Yeah, definitely. And it's I do actually love talking about my accident, my journey over what's it been now? Nearly coming up to 10 years. So it was a very long journey. 5 of those years was without medicinal cannabis. So I'm about halfway. One of the biggest issues I had was essentially the spinal damage that occurred, the root nerve damage, I can't feel parts of my left and right leg, parts of my shoulder. There's parts of my face that are still numb, that may never come back as well. So but the pain was always there from the nerve pain, because the body trying to just wake up those nerve endings, nerve cells. That was one of my biggest issues, was the nerve damage, which happens with most people with spinal damage, spinal injuries,
was this
root
from
nerve injuries, which are very common.
Like a sort of an accident with a vehicle, or like how did you find yourself in that car accident, was it?
Yeah, motorcycle accident. A guy, pretty much turned off the road onto me, and I hit him doing about 110 kilometers an hour, which, it was a long recovery, that part. Very lucky to be here. Multiple surgeries. What have I had so far? 27, I think. They've amputated my right leg twice and put it back on.
Just looking
Big
at you
shout
now.
out to Professor Jolt at John Hunter. Thanks, Jolt. Good work.
Jolty. No, that's unbelievable. You're looking like just this shining, healthy beacon. It's hard to believe, through that's been the journey that you've been on. And 27 surgeries, nerve damage, spinal fractures. So they very quickly would have had you on the endone, or what kind of opioids did they treat you with?
Lots of opioids. I pretty much didn't move a great deal for about 6 months. Probably, I wasn't walking until probably around the 6-month mark. So I was learning to walk, I think it was about month 4, after because I had a lot of X fixes in my pelvis that were actually outside because of the brakes. And it was quite difficult because the body didn't really know what to do. So I was in a wheelchair for probably first 1.5 years, 2 years, in and out. and in bed a lot of the time, probably only out of bed for maybe 2 hours a day in the first 12 months. So it was very difficult. Massive support from my wife and family and everyone else. I literally wouldn't be here without them. So it's one of those big things, and it's great for them to actually see where I was to where I am now.
Yeah.
And it kind of gives people a lot of hope that, yes, it's bad now, especially when you're injured, because you can't think past that today, because that is literally all you can live for, is just the day. You can't take it. You can't go, oh, in 6 months I'll be okay, because literally it is day by day, and it is a long road to recovery, and it's a mental journey as well.
Sure. But that would create a lot of, I guess, inspiration for a lot of people that, are finding it hard to see the forest from the trees, I guess.
Definitely. Yeah. And that was also one thing that the medicinal cannabis was brilliant, that actually brought back my sleep patterns back to normal from all the damage that, so it took me about 3 years to learn to roll over in bed again.
Whoa.
So it was a long journey. I was literally fixed in one spot.
Yeah, I had some very minor surgery. I won't even put it in remotely the same ballpark that you've been describing, but I was on the endo and in the aftermath of that. And all the side effects with, you feel all bound up, digestive system and everything.
Yep.
It's an absolute nightmare. And sure, okay, pain relief, tick, but a whole myriad of other problems that follow. I'm just thinking long-term use of those products and having that, you would have obviously reached a point at which your body, your endo opioid system begins that dependency. What was that like, withdrawing from it and sort of moving to medicinal cannabis? I think you said it was about 5 years ago that you started that.
Yeah, well, it was quite fast. For me as a patient, it was very, very quick. I was probably within 3 weeks that I was starting to get less pain from nerve damage so I was on the trial, I think, for Sativite back in 2016. I think it was one of their final stage trials, and I was a part of that. So the spray, and it worked really well.
Well, sometimes this does happen. We get a little bit of a disrupted feed, but that's all right. Might just get you to just that last bit you were saying. So 3 weeks, and you were already able to transition pretty well. Is that really sort of
yes? Within 3 weeks, I was feeling the benefit, mainly through sleep. So I was sleeping a lot better, which was excellent, and it really, really did. It just opened my eyes to what was possible. And then over the next probably 2 months, I started to just think to myself, well, maybe I don't need the pain drugs as much. So I just started to reduce them myself, because I thought, well, if this is working and I'm getting more pain relief, why not? So that's when I started to step back. And that took probably 3 years. I'm finally off them 100% now. I was on, I think it was about 180 milligrams a day. So it was a decent amount.
Whoa. Of opioid, was it endone or something else?
Yeah, Oxycontin.
Oxycontin, 180. Because I got given after my surgery, I don't know, maybe they picked me as potentially someone that might have a hard time kicking the habit or something. I'm not sure, but they only gave me 5 milligram tablets. So they were playing very safe with me, but 180 milligrams a day. And you've probably, what was the actual product that you were, so you said Sativite, what kind of dosage were you on for, I assume, CBD and everything? How was that?
Yeah, it's a CBD 1-to-1 spray. So it was, what was it? It was probably about 12 times a day. Every time I felt a bit of pain coming on, I'd just spray it in my mouth. And within probably 5 minutes, it'd actually subside fairly fast, even a lot faster, because I think once it's built up in your body, it does last a long time. I know with my nerve pain now, I can literally go probably 24 hours with no cannabis treatment, and I don't have any pain. But after that 24 hours, that's when the nerve pain really strikes again.
Okay.
Yeah, wow.
Yeah.
Right, so then that's brought you to, I'm guessing, this long kind of quest almost to tell people about the story, say there is hope, and then obviously out of that, I'm assuming you was born Sativite, and I guess a company that would allow you to further that research and really provide the most benefit to other people in the community that might be suffering from a similar condition.
Yeah, and we forgot to mention you're a farmer as well, so that ties in a bit too, doesn't it?
Yeah,
it certainly does. I know what the hemp, field hemp, actually does to the soil, which is amazing things as a cover crop, and just something to recycle all the nutrients that are in the soil. The cannabis plant is unbelievable. So if it's that good for the soil, it had to be good for us.
Yeah.
And that's the whole theory.
So tell us a little bit about that kind of farming background, and one of these terms, regen farming, for some others that might not be aware what that is.
Yes, so very, very passionate about regenerative farming. Been a member of Australian Soil Planners, which is a farming group that really specialise in producing the best. I suppose it's nearly food for medicine is one of the big things. So because the soil is so healthy and working so well, it just goes to show that the grains grown from that soil actually are a lot more nutritious for people. So they're actually a lot more nutrient dense than standard, and we actually see a lot of it. We've actually the guys have got flour mills that have partnered, and a lot of bakers now that are on board, the artisan style bakers, and they love the grain, the dough strength and everything that comes from it. So we had a bit of a chat going back quite a few years ago about it, and that was when I first started medicinal cannabis. And the guys said, well, why don't we start growing this stuff? And I said, it's a bit harder than that. You need a license and Office of Drug Control, and they said, well, we just need to find someone that can do it. So we got the team together, and the guys went, okay, let's do this, because the second reason for getting into the medicinal cannabis space from the farming side of things was also the supply. So supply was so erratic in the early days for medicinal cannabis patients. And to me, what happened on quite a few occasions was I couldn't get enough medicine. So they would literally run out for a week or two at a time. My issue was I was straight back on the opiates, because that's literally was the only thing that would work other than medicinal cannabis. I've tried everything else. So the only way to get relief was there. So then the side effects started again. And it just, to me, I know what I was going through as a patient, and I was thinking of everyone else as well. And I thought, well, there needs to be more in the market. That's the only way that this is going to get better for patients and for everyone. We just need more cannabis people in the market, promoting product and getting the best quality product out to patients. So especially considering the illicit market is so strong.
Yeah, 100%. And so on that piece around the better quality, tell us a little bit about that. I know you're talking about carrier oils and terpenes and being critical in what you see as the future of quality in Australia. I'd love to get your thoughts on that.
Yeah, we keep abreast of a lot of information that's happening overseas. A lot of research is happening. Due to COVID, we haven't been able to travel over there for a few years to trade shows and different things where we'd normally pick up on a lot more of the scientific explorations that are happening. But we've got a few partners over in Canada, which they are doing some great things at the moment with the terpene. And I suppose the biggest one that I really love are the increasing the bioavailability of medicines to make it more efficient for patients to have it. So, which would make it cheaper. So that's one thing I really like to see, is that if we can increase the bioavailability of this chemical in the body, well, it's going to make the product cheaper for the patient. And at the end of the day, that's what we want. We want patients to have more access to this type of medicine. And because it's not on the PBS or the pharmaceutical benefits scheme, it is quite highly priced. So it's a very hard decision to make. Do you pay $500-600 a month for medicine, or do you stay with the $6 a script for the other drugs? It's a tough one that's unfortunately some people don't even have a choice in. They've just got to stick with the PBS style prescriptions because they just don't have the funds to do it. And I can see driving that price down being key to this.
Yeah, amazing. So in terms of when we're talking about those products that in the research in Canada and the rest of the world, when you're talking about excipients and or carrier oils and terpenes, what do you see the direction for the product differentiation? Is there any insights in that you can feel free to share, or
Definitely
don't want to take any IP, but
there's a lot of developments happening with the entourage effect, as they say, and terpenes. I know with a lot of our flower and how we do that, we try and protect the terpenes. A lot of cannabis that is grown and even imported into Australia has to be irradiated. So that does the gamma radiation it's a safety thing that has to happen. It ensures safety of the lungs for patients, but some of the side effects are that the terpene profile gets broken down through that as well. And that's why we end up moving towards the canning of the product using nitrogen to ultimately make it more stable, but also create a vacuum to kill whatever's living in there. So we're seeing some great results from that. It's been around a long time, the canning of anything. So we were over in, I think it was Canada and America a few years ago when we first seen it. And the guys just said, we need this. This is going to make such a big difference to the patient in the long run. And that's why we went down that path. But the terpenes in oils are very interesting again, because we can actually add them back. Part of the breakdown of the oils is adding back terpenes. Still a lot of research needs to be done. I'm a massive believer in a lot of the terpenes having that entourage effect, which from my understanding works probably even better with THC than it does CBD. But that's just from my, I suppose, our R&D with Sativite, doing some R&D on that as well.
Oh, there's quite a few people I think have put their hand up for R&D on THC and terpenes over the journey.
Definitely.
There's a line, I'm sure. But that's very interesting. We talk about this. This is one of our favorite topics to actually talk about. We were talking with a guy, Matt Shales, about this in one of the previous episodes, and just the combinations that may or may not be out there, and which ones are kind of preferential, and what's your favorite terpene, myrcene, limonene, bisbol, that kind of thing. And then the next kind of layer of uncharted entourage effect, which is flavonoids as well, coming in there to create, and like that seems to be the next frontier that hasn't even really been grazed at this point. It's people know it's out there, and it's responsible for certain different colors and things like that. But that research is even less than terpenes. So it's very interesting to see what might be uncovered over the next 5-10 years, and
it's almost so every part of the plant has something exciting about it. I mean, save for the stem. The stem's pretty boring. There's not much in there, but
they use that in
that's true.
We use that. We use that in to make hurd and fiber from. It's a lot of the hurd actually gets sent. Makes paper.
Oh, mate. Well, just disregard everything I just said.
Don't bag it, Andrew.
Oh, sorry.
Sorry,
cannabis. I'm sorry, cannabis.
What's the? There is an old saying actually. It's what do they say? The cannabis plant is like the pig. You can use everything except for the squeak. And that's I've remembered that one. That's actually from a colleague of mine, and because it is so basically literally. It's
a kosher pig, is what you're trying to say.
It is a kosher pig. Sorry, that's right. It's and it's amazing. Like, well, even I was watching a podcast of
AltMed?
one of the first people. Actually, it wasn't one of you. It wasn't AltMed, unfortunately, but I should give you the name of this this contact we've got over in America. A lot of research with the cannabis root to actually extract some. I know in Aboriginal culture, they use the cannabis root a lot in medicine for making teas for sore stomachs and sore throats. So so they've probably taken that a little bit further. They're a First Nations company over in Canada that were developing it. So that's right. Yeah, it's very interesting and so it's the root as well. So all of a sudden you've got the root, the stalk, the flower. It's an amazing plant, and
what are they
we've
doing?
Really only just rediscovered it.
I'm just curious, what are they doing with the root?
They are doing, they're pulling certain chemicals and different structures out of the root that will actually target different diseases, which is quite interesting. Without saying too much, they've got some really good R&D going on, it's amazing. It's from the root of a plant, and it's what can be done with this, especially with now the larger pharmaceutical guys getting involved in cannabis. They'll take it to the next level. They've got the experience to actually make it even bigger and better.
Mm-hmm. I was going to say I need to get a root, but obviously in the context of what we're discussing. But yeah, that's seriously amazing. I mean, I never would have anticipated the R&D frontier has gone to that place, but my goodness, it's so much happening. But what about in terms of like yours, and we, mindful not to speak specifically, but Sativite's actual flower products, are these, what kinds of strains are we able to talk through some of that, or is that? Yeah, cool.
Yeah, sure.
Are we? Do we do that? I'm not sure.
We talk strains. I don't know.
I'm not sure. That's probably
maybe
touching on
maybe not Sativite strains, but maybe just generally about some of the strains you like. Maybe let's say.
They're all the strains are great. It's definitely you've got to try as a patient. I suppose speaking from experience, you've got to try a lot of. I suppose it's what works for your body and what's ailing you at the time, because we already know about the terpene effect. So one of the key effects, I know with everything we do, there's COAs with full terpene profiles, THC breakdowns. The doctors now that we're seeing, they're really looking at the whole COA certificate of analysis for patients, and actually having a really good conversation with them around what's worked for other patients with similar issues or injuries, and just where it really helped. I know a lot of strains that work for me are usually sativas, because they're a little bit more uplifting, more of a body uplift, which is what you want when your body's broken. So I find that's definitely my strong point is that. But for every patient's different. Insomniacs want heavy hitting indicas to put them to sleep. And the best thing is you can literally try all different types. it's all there.
You got to cast a wide net.
Part of that R&D bit with the high THC that you were doing, is all in the name of science, obviously. But
definitely.
Tell me, were you ever were you ever on medicinal marijuana prior? Had you ever tried it earlier in your life or that kind of thing?
When I was a young guy, I did. Probably a teenager, like most teenagers. I did try it. Didn't do a lot for me. I was like, oh yeah, it's. I'd rather have a beer. That was ultimately how it worked. Had a lot of mates that used to enjoy it a lot, but it never really done much for me until I was injured, and that's when my body really did. It done amazing things. It's definitely a medicine. Most people that I think use it recreationally, definitely it does help. I come across people all the time telling me their story about post-traumatic stress disorder from abuse and everything else. And they actually say that it has helped them a lot. It really helps them sleep, lets them deal with their issues as they come up through flashbacks as well. So it's an interesting one, but it's definitely a medicine plant. There's no doubt. So yeah, I'm as you can tell, a massive advocate of it, because it really does get out. And ultimately, it's not about plugging product. It's about giving patients just a wide range of products, like from all of the pretty much cannabis companies out there now. We really need to band together and make it about the patient, which we are. I know, talking with other cannabis companies, we do have a chat about what's happening, and we see what's happening in the market with each other. And I feel that driving it forward for the patient advocates is where we're really going to get, I suppose, our best bang for our buck as a group of patients trying to just improve life for everyone.
Yeah, absolutely. It's interesting that cannabis and beer or hops actually do come from the same family there. I know,
Certainly
Andrew,
do. They're cousins.
Yeah.
Andrew, you've tried to use beer medicinally, I think, but that might have had something to do with that root R&D you were doing. I'm not sure.
Yeah, no, I honestly, yeah, that, like, I don't know, having a beer and having some oil, you can actually taste like the crossover between hops and all of the terpenes. It really is fascinating. I'm a very big fan of the IPAs and all of that. So yeah, all about those pine and other
Terpenes.
nuts that you get in there. What's that?
Terpenes and flavonoids.
Yeah, absolutely, the terps and flavs. But yeah.
Yeah, it's great. Well, even Delta 8. I don't know if you guys have heard of the Delta 8 THC.
Yeah.
As yet, fairly big overseas with a lot of it. It's an interesting one, and it's part of that technology again coming out from deriving it from CBD, just running it through a certain process and extracting pretty much what would you call it, like a light THC with less side effects. Very interested in some of that. I know in America it's under a farm bill, which is quite interesting, but I do feel in Australia we'll start to see some of those products coming out, mainly because it has been over there for quite a few years as well. So yeah, it just goes to show that we've barely scratched the surface with what this plant can do, and just with ultimately what it can do for food and also the environment. The carbon capture of hemp is unbelievable. It is literally amazing.
Yeah, it's incredible. I agree with you. And also on that part about the other, say, Delta 8, for example, and other minor cannabinoids, CBG, CBN, we see a lot of discussion about that of late. And I've been seeing a lot of people talking about CBN for sleep, for example, of late. There's a lot of buzz around that. We're fans of CBG, CBC as well. That seem to be ones that you get to see a little bit more often when you start delving into fuller or broader spectrum products that are out there. But definitely, I think we're going to get to a stage one day where you have basically all of these compounds, which we've done the studies on, and CBG does that, CBC does that, pinene does X, kind of has effect, and then you start making these almost cocktails or concoctions that are specifically catered to, here's a sleep formula, here's an anxiety formula, here's one for chronic pain, here's one for neuropathic pain or fibromyalgia, for example, and you'll be taking, now we just call it the entourage effect because the research we haven't fully done, but I mean the science is out there. It just has to be completed, I'd say. So I think one day it's very interesting. I almost see it like this idea of having products that you like mix your own almost kind of thing. Maybe not in Australia, but in America, where you're like, you can kind of grab a bit of that off the shelf, put them together. Choose your own adventure.
Yeah. That's what compounding chemists do essentially. Yeah. So and I really think it's important that the compounding chemists, like they can come up with some great things. And we use a lot of compounding chemists' feedback on products that they'd like to see, because they're at the coal front as well as of this I suppose the oils more so than the flower, but definitely the oils, because they're seeing what's really working in the market. They're nearly like an R&D team themselves.
Yeah, they're doing some amazing work in the Australian landscape, because they're the only ones that can really do kind of small batch brews and really test out, they're kind of excluded from all the other regulatory hurdles, and that allows them to really take on, I don't want to say burden, but to really sit and create the formulas for the lab rats out there.
Yeah, and also the like we're seeing, I don't know, CBG isolate products and things like that. There's just so much potential to be bringing in those other minor cannabinoids as isolates and having them compounded. So I guess it's that's, I think, what we're going to see more of in the next few years. I also think just pharmacy generally, whether compounding or not, or just retail setting, anyone who's dispensing cannabis is in that sort of position where they can observe, if they're dispensing multiple brand different products from the pharmacy, they sort of, as you said, they're at the cold phase. They can see, patients might be coming back and reporting in a glowing way about certain products. And so they've probably, I think, always got a very good barometer on, which ones really work and which ones are maybe not as effective.
Definitely. That's what we've found from my experience with, because I'm a big believer in bringing out some new products all the time. Like it's part of every medicinal cannabis company to be doing that. Like we really need to be casting our eye wide to what the rest of the world's doing, seeing what fits in with our legislation over here, and really driving it forward, because that's how we're going to drive the industry forward is through this product change. Australia is a very small market, so a lot of the bigger players don't really want to come to Australia. So it's up to us to go over there and see what they're up to. And there's some exciting developments really happening at the moment now, especially in the medicinal market. Even though the recreational has opened up quite a lot in America, still a lot of companies over there that are just concentrating on medical, because they can see the benefit of actually having doctors prescribe this for certain illnesses, certain ailments, rather than going to a dispensary where you can try everything, but realistically, if you can go to a doctor that's already got knowledge, he can narrow it down to maybe 3 or 4 different products instead of, I know overseas there's probably 6,000 products in any one dispensary. So it can be confusing.
Yeah, absolutely. And I think that's where Australia will play very well in the medicinal space. I mean, we do have quite a reputation for a high standard of medicinal products in general. You put us, in that kind of echelon with Switzerland and Germany and that kind of thing. So I think I can see, that's the approach we've taken. It fits the bill, and I can see us really kind of excelling in that area as a nation, I would say, as opposed to the recreational world.
Definitely.
Legal.
Yeah, and if you can survive in Australia, you can survive anywhere.
It's true. If only we could use CBD for snake bites. No, I don't know if there's been any research into that yet. But
we just need to get a route for that, Mitch. But anyway, I think we. Sorry, I just wanted to get it in there again. Loving the lag. We're really getting a tough crowd with the lag, or maybe it's just a tough crowd. But no, I just wanted to say, Mike, thank you so much. I'm sure we'll as you progress with Sativite and everything, we'll be sure to check in again at a later point. But just wanted to say thanks so much as well for just opening up and sharing, your journey as a patient. Big shout out to your wife and family, as you said. You always need that support crew. And just to see, to come from that place to where you are now, it's quite extraordinary. So to share all that and to
it certainly is.
bet when you
if I can do it, anyone can do it. That's the thing. If I can do it, it's literally anyone can do it. I'm not overly special. I'm just very lucky to be here. A lot of good people around me, a lot of good surgeons, a lot of good physios. And that's why I'm so passionate, because I often think about it and I go, gee, I probably wouldn't be here now with the amount of medicine I was ingesting. It was only a matter of getting another drug, and anything could have happened with a counter effect, because I think I was on about over 20 different prescription drugs at one stage. Whoa. So it was fairly up there.
Jeez. Well, yeah, you've weaned off all that. Your days of, polypharmacy cocktails are well and truly behind you. And yeah, very good to see you getting great results from medicinal cannabis. So thank you so much for joining us for AltMed, and we'll be sure to pick it up again for further discussion a little bit along the way. Mitch, did you have any final thoughts for Mike?
Well, I've got to give Mike the obligatory philosophical. But the last question that we asked. Thank you very much. I parrot what Andrew said about sharing your story and all that. But we do need to ask you, when, if ever, you see recreational cannabis in Australia? Timeline.
That's a very, very tough one. It's I certainly do see it coming in. I would imagine within about 10 years. Maybe it's a bit of wishful thinking on my part, but I'd really just love to see access improved. That's my thing. I think there's no need to recreate. It'd be great if it was recreational, because it means it's more accessible to patients that need it. So I would love to see bulk billing clinics for cannabis, and also to start seeing some cannabis on the PBS. That's what I would like to see first. Some subsidies for current setup. So that's just me. Knowing that a lot of our patients, really, it's expensive medicine, and we've just got to make it more accessible.
We've had some more ambitious guesses than that. I mean, we're going to hold you to 2031, but we've had some guests on the podcast that have put out the feelers for sort of a 5-year. I think what we should do, Mitch, actually is trawl back through the podcast. Maybe in so doing, we can add a few views to the view count, and we'll get all the answers and collate them on the AltMed website, and
do a little chart tally.
And we can, I don't know what the prize is. We'll come up with something. If it goes recreational in the next 3 years, then the prize will be some sort of recreational product. But
it would be.
But I think that's the way we need to go. But anything final as well?
Definitely.
No, that's been, it's as you said, it's actually been one of my favorite podcasts, to be honest. It's been a great little yarn. So just have to say thank you very much to Mike for joining us this week. And,
happy to talk about any experiences. Happy to talk to patients. It's just we really need to just make people better, and this can do it.
100%. Well, we will. We look forward to our next chat with you, Mike, and thanks so much for joining us.
Great. Thanks, guys. Have a good one.
Cheers.